Namaste. This is Dr. Vaishali Ashok Bhide, MD Homeopathy. Today we will be talking about sinusitis. Sinusitis is inflammation of the sinuses which are found in and around our nose. So there are three pairs of sinuses: frontal sinus, ethmoidal sinus and maxillary sinus. These sinuses are very important because they will humidify the air which is entering into the respiratory tract. They secrete mucus which helps keeping the nasal tract warm. Thirdly, they are closed spaces, however they are hollow spaces, so they have reduced the weight of the bony skull. These are the important functions of the sinuses. These sinuses secrete mucus, or it's a very watery secretion initially. However, when the sinuses get inflamed, let's say there is an infection and the sinuses will get inflamed, here the secretion increases. Initially it may be watery, later on it may turn thick white, and as days pass it may turn into yellow or green secretion. So basically what happens is, the sinuses, which are closed hollow spaces with a small opening to drain the discharge in the sinus, these sinuses become full with the secretions, and these are responsible for majority of the symptoms of sinusitis. So let's see what are the types of sinusitis. There are primarily two types of sinusitis which we see in practice, that is acute and chronic. This is divided upon the number of days or weeks the person has suffered. So in acute sinusitis, we will see all the symptoms of sinusitis for around 4 weeks to 12 weeks, not more than that. If the symptoms of chronic sinusitis, that is, if the symptoms of sinusitis persist for weeks together, say more than 12 weeks, on and off, then we know that this is chronic sinusitis. Here it is important to differentiate because the cause underlying both of them is different. Now let's see what are the causes of sinusitis. The commonest cause of acute sinusitis is a viral infection or the seasonal flu or bacterial infections, very rarely fungal infections. Chronic sinusitis is caused because of allergic conditions. A prolonged allergic state will give rise to allergic cold, asthma and allergic sinusitis. So sinusitis which spans into many months, we know there is allergy in the background. Now what are the symptoms of sinusitis? As we have said that the sinuses become full with secretions, so there is pain in the localized area. For example, in case of frontal sinusitis, there are headaches. In case of maxillary sinusitis, there will be pain which may look like a toothache also, along with the pain in the cheek. Maxillary sinusitis, here we have to know that since the sinus is draining against gravity, this one is very painful and little difficult to treat. Here the other symptoms are all the symptoms accompanying the viral fever or the respiratory infections. That is cough, cold, sneezing, fever. These are common symptoms accompanied with sinusitis. One hallmark of any pain in sinus, especially the frontal sinuses, we ask the patient to look down, and whenever the pain aggravates when they are looking down, we know that it is a case of sinusitis. Let's move forward to the treatment of sinusitis. Here, two things we will again think of. One is the auxiliary or a non-medical management. Second is the management with homeopathic medicine. In non-medical or auxiliary management, it is most important, that is steam inhalation. When you inhale warm steam, the inflammation of the mucous membrane lining the sinuses goes down, the secretions liquefy, and the pressure symptoms in the sinus, which was causing most of the symptoms, will go down. Secondly, it also helps in reducing the virulence in case of viral fevers or bacterial fevers. Again, hot water gargles also recommended. Second is the homeopathic treatment. Now in case of acute sinusitis, we know that this is acute infection, a change of weather, a seasonal flu. In that case, acute history is taken, which means a very short history is taken of why the illness has occurred, whether it was drinking cold water, whether they had just had cold water after a warm bath, or they have been exposed to too much of heat, after which they have landed with sinusitis. So these are all the reasons why they have got this infection. That is very important to us. Secondly, which sinus is involved. Then what are the modalities of aggravation, which means sometimes they are more aggravated in the evening and they feel much better in the morning. Occasionally they feel very light after a warm bath, but immediately as they step into a cold room, they start getting their headaches again. These are important symptoms. Then the type of discharge, which means if the discharge coming from the nose or the expectoration, what is the color of it? That is also important because that is signifying the infection or the stage of infection. All these are taken and medicine is prescribed, and usually within a day or two, the symptoms of sinusitis reduce drastically and it responds very fast to treatment. Second is chronic sinusitis. As we have said earlier, chronic sinusitis has allergy in its base. So we take detailed history of the childhood illnesses, illnesses in the family, then the type of symptoms they normally get, what is the chronology of symptoms. Say first they would get sinusitis, then they'll get nose congestion, then there'll be nose block. So there is a cascade of symptoms. We'll take the details of that. We will take modalities. We will take stress in their life, their sensitivity to events, their reaction patterns, and a medicine is prescribed. Once this medicine starts working on the patient, allergy is worked on its base, which means the other complaints of allergy, which means it could be allergic rhinitis, allergic skin complaints, or asthma. All these also get better with the same medicine because we are working at the base of allergy. So, this is how both acute and chronic sinusitis are treated effectively with homeopathic medicines. I have recently published a book on homeopathic medicine titled Unlocking the Boger Synoptic Key Part 1. It is available on Amazon. I am currently practicing in Dadar West Shivaji Park area from afternoon 1 to evening 7 pm. On Mondays, Wednesdays and Fridays, I practice at Park Polyclinic 5 Shankar Nivas, Dada Saheb Rege Marg. On Tuesdays, Thursdays and Saturdays, I see patients at Sapre's Polyclinic, Manik Building, DV Deshpande Marg, Shivaji Park Road number 4. You can also follow me on Instagram, YouTube and Facebook. Stay healthy, stay blessed. Thank you.